someone who has suffered a stroke. Joel Nichols is at St. Luke's Hospital with a new treatment that can change lives.
It is Stroke Awareness Month, and if you or a loved one are having a stroke, the best place to be, one of the best places in the nation, is right here at St. Luke's. The technology is amazing, and this man's story is amazing. Kurt Hendricks has your name right there because this is your head right here. So tell us what happened on that day that changed your life.
Yeah, I had gone to bed, and my wife came to bed about an hour later, and she started snoring. And so I got up out of bed trying to get to the living room, and I crashed. And my wife heard that, and so she came around and she helped me get up, but now I'm not talking, and my entire right side is paralyzed. I can't do anything, so she helps me get on the bed. And then she figures out quickly she needed to call 911. So she called 911, and the paramedics from Gladstone got there.
And time is so much of the essence. And what we're looking at right here on this one, you're going to see a little, right there, like a little fishing line. And it actually goes up into Kurt's head, right, and finds that clot and then pulls that out, just like a fishing line. And I think on this one, look at this here. I'm going to take a look at that. And while we're looking at it, tell us what we're seeing there.
Yeah, Dr. Coleman Martin had a nickel in his pocket, and after he pulled that clot out, he wanted to have proof of the size of the clot. And so he put that nickel down and put that stent retriever down with the clot in it and took that picture.
It is unbelievable. Dr. Karen Olds is also here. And in Kurt's case, there were really, he wasn't somebody you would say, oh, you've got high blood pressure, you've got things. What should we watch for, and can stroke affect everyone?
Stroke can affect everyone, and we do look for our classic risk factors of hypertension, diabetes, smoking, and high cholesterol. However, there are other reasons to have strokes as well, and we like to do a good job at St. Luke's Hospital of trying to find those other odd reasons that might be occurring.
And we hear the acronym FAST. Tell us what FAST stands for, what we should be watching for.
FAST is what we teach for signs and symptoms of a stroke and what to do. So F is for face, and you look to see if the person has a facial droop, or on yourself in the mirror. A is arm, and that's for an arm drift or weakness of an upper extremity. S is speech. Can the person talk? Is the speech slurred? Can they get their words out? And T is for time, and time is of the essence. So our stroke reversal treatments here at St. Luke's work great, but time is a very important factor. We need to get to you very quickly.
And there's no better place to get to quickly than here at St. Luke's. This is a fascinating story, and that picture right there really tells the whole story. So it is the month to be aware, every month to be aware of stroke, and this is a great place to go if you need that help. Joel Nichols, 41 Action News.